afternoon and welcome to everybody joining us. I particularly welcome members of the board and especially members of the public joining on MS Teams Live to this RCHT's annual public meeting for the 2021-2022 annual report and accounts. Before we go into the main business this afternoon, I want, on behalf of the board, to record our sadness at the passing of Her Majesty Queen Elizabeth II. Many of us were very moved by the wonderful funeral services on Monday. Her Majesty's legacy endures through her unwavering example of dedication to public service and the reminders to us all of the importance of wisdom and humour in the face of adversity and challenge. For me, that is wonderfully captured in the poem by Simon Armitage, the Poet Laureate, entitled Floral Tribute. It's comprised of two verses. Floral Tribute describes the coming of a September evening and the appearance of a lily as a token of thanks. Simon Armitage used the acrostic technique to spell out the late Queen's name and said in a recent BBC interview, "It's a lovely name, but a name she probably rarely got to hear very much because everybody has to preface that with ceremonial nominals." I'm going to attempt to do justice to the poem. Evening will come, however determined the late afternoon. Limes and oaks in their last green flush, pearled in September mist. I have conjured a lily to light these hours, a token of thanks, zones and auras of soft glare framing the brilliant globes. A promise made and kept for life, that was your gift. Because of which, here is a gift in return, glovewort to some. Each shining bonnet guarded by stern lance-like leaves. The country loaded its whole self into your slender hands, hands that can rest now, relieved of a century's weight. Evening has come. Rain on the black lochs and dark Munros. Lily of the valley, a namesake almost, a favourite flower interlaced with your famous bouquets. The restrained zeal and forceful grace of its lanterns, each inflorescence. A silent bell distinguishing a singular voice. A blurred new day breaks uncrowned on remote peaks and public parks, and everything turns on those luminous petals and deep roots. This lily that thrives between spire and tree, whose brightness holds and glows beyond the life and border of its bloom. The Queen was often quoted in recent days and weeks that grief is the price we pay for love. May she rest in peace. Thank you for your thoughts in that small tribute we pay to her. The purpose of an annual public meeting is for the board, as the current stewards of Royal Cornwall Hospitals, to set out how the trust was run during the 2021 to 22 and to explain our finances and our performance. We really hope you find the presentation this afternoon informative. We set out what has gone well and what we're working to improve. As ever, we welcome questions from members of the public and are happy to receive those via the Q&A function on MS Teams Live on issues relevant to the annual report and accounts, in line with the protocol on the questions. The function from questions will be turned off just before the look back video is played towards the end of item 4, and questions will be put to the board at item 5. During 2021-22, we were still, of course, responding and adjusting to the ever-changing waves of the COVID-19 pandemic. And we want to recognise the enormous impact that has had on our staff, our patients, and our services. Many of us have felt the pressure, stresses, and fatigue this brings. And it is with deep gratitude that I thank all of our colleagues in all roles across all sites for their dedication to the communities we happily serve. I'd also like to thank their families and the wider public for your support and understanding of the pressure we have all been under. The Trust Board of Directors is charged with being the steward of this organisation, and we are mindful of the impact of our words and actions on others. We are part of a wider health and care system and can't do what we do without the help, support and understanding of our colleagues in partner organisations, in the NHS, in the local government and in the very wide voluntary sector. To them we say thank you, and that although we have challenges to overcome, we can solve the problems together for the wider benefit. So, without further ado, I'm going to move us to the main items of the meeting agenda. First of all, do we have any apologies for absence?
Thank you, Chair. We have apologies from Sarah Newton, Non-Executive Director, and Robin Jones, Acting Chief Operating Officer. Thank you.
Thank you, Sian. Moving then to item 2 on the agenda, declarations of interest. Are there any interests that board members wish to declare in relation to items presented today, other than those already disclosed in the register of interest? I'm seeing heads shaking. Thank you. Then coming to item 3, can I invite the board to approve the minutes of the last annual public meeting held on the 2nd of September 2021? If you would note your approval in our chat, that would be very helpful. Thank you. So, at item 4, I would now like to invite our Chief Executive, Steve Williamson, to lead off with his reflections on the challenges the Trust faced during 21-22 and an overview of our performance. And of course, this is your first APM with us, Steve, having joined in January this year. And although it is a little late, it's nevertheless very much a pleasure to have you working with us and for our communities. So I'll hand over to you. Thank you, Steve.
Thank you, Mary. It's an absolute privilege to have the opportunity as Chief Executive to present at this first annual public meeting for me, so thank you. Can I also say, though, firstly, on behalf of our staff, how deeply saddened we all are by the passing of Her Majesty the Queen, and send our heartfelt condolences to King Charles and the royal family. Our hospitals are immensely proud of our Royal Association, and I know that we all draw strength from the exceptional devotion Her Majesty has shown to serving our duchy, our country and our Commonwealth. Her Majesty was tireless in her dedication and devotion to our great nation. As our longest serving monarch, she shaped our country through triumph and through turbulence over 70 years as our Queen, and was the rock of our society. Her dedication to duty, her compassion and her care for everyone was something that touched us all. And that incredible devotion to duty from our Queen, I know, will provide inspiration to all who work at Royal Cornwall hospitals. If I turn to the overview of challenges over the last 12 months, I think it's right to say this has been an exceptionally challenging period for Royal Cornwall Hospitals NHS Trust here in Cornwall and the Isles of Scilly, and I also know it's been very challenging for other parts of the NHS across the country. As our chairwoman has said, the context for us was clearly one of a COVID response. Throughout 2021-22, our amazing staff protected our patients, protected our communities, and protected each other from the threats of COVID. We delivered over 850,000 vaccinations. Our research and development team focused their efforts and made a direct contribution to the National COVID Trials programme. Our hospital teams managed extended COVID waves and periods of significant COVID prevalence in the community and within our hospitals as we managed large numbers of COVID-19 positive patients. And of course, throughout that COVID environment, many of our staff and their families, as parts of our community, were of course also experiencing COVID implications themselves. Alongside COVID, we've also experienced sustained and significant operational pressures. Our hospitals have operated at a critical incident level of escalation for much of the reporting year. We experienced and we continue to experience significant numbers of our hospital beds which are occupied by patients who finished their hospital stay and are medically fit for discharge but waiting for social care before they can go home or waiting for a place at a residential or nursing home. In their recent system inspection, the Care Quality Commission in March 2022 identified that staff shortages in social care in Cornwall were amongst the highest in England, and that resulted in a shortfall in domiciliary care packages and care home capacity. So clearly all parts of our health and care system are under exceptional and sustained pressure. And in fact, at any one time, over 100 of our acute hospital beds might be occupied by patients who've completed their hospital stay and are waiting for discharge, and of course they're therefore not available for our new emergency patients. Our newly formed Cornwall and Isles of Scilly Integrated Care Board, which was established in July this year, sees this as one of the greatest priorities for health and care system partners, and all partners are focused on working together to address these challenges. In this really challenging context, we have progressed and achieved some really outstanding results and progress across our trust to support our patients and to support our staff. Colleagues may be aware that earlier this year we opened the first phase of our new Tremenal unit, which allowed a new ward to support an innovative reablement model of care to assist patients in a more rapid discharge home. Our building works for the new MRI Lowen Cancer Centre have progressed well, and we expect that to complete and open in early 2023. That development will transform access to cancer care, bringing together cancer diagnostics and cancer services to really transform the experience of cancer patients in Cornwall and the Isles of Scilly. And we achieved some really outstanding friends and family test results about what our patients say about the quality of the services that we provide. So in this exceptionally challenging environment that we've faced over the last 12 months, I'm so proud of what staff across Royal Cornwall Hospitals NHS Trust have achieved and do achieve every single day. Our Trust has three strategic objectives, and the first of those is Brilliance Care. And if we reflect for a moment on the scale of the services that we deliver, it is truly amazing. Our staff supported 120,000 inpatient admissions and emergency attendances last year, supported over 4,100 babies being delivered, and delivered over 850,000 COVID vaccinations to more than 370,000 people. Our teams met the national target to offer every eligible adult a booster vaccination by the end of December 2021, and by early March this year, March 2022, the vaccination centres in Wadebridge and Stithians alone administered over 250,000 vaccinations between them. Truly outstanding work from a great team. And that team worked really hard to help tackle health inequities with mobile and roving vaccination teams to reach traveller communities, to reach fishermen and to reach homeless people. and also developed an in-reach hospital service to provide vaccination to those patients in hospital who hadn't yet had the opportunity to receive their vaccination. Our infection prevention and control team were truly outstanding and played a really essential role in helping our hospitals utilise as many beds as possible throughout the pandemic whilst protecting staff, patients and visitors. Our overall Care Quality Commission CQC rating has remained unchanged this year. It requires improvement. And within that, the individual assessments of safe and responsive continue to be requires improvement, and the individual assessments for effective, caring and well-led continue to be good. Our urgent and emergency care system was subject to a Care Quality Commission inspection earlier this year in March 2022. That inspection did not result in any change to our overall or individual ratings assessments. However, it did place some actions and requirements on Royal Cornwall Hospital to reduce ambulance waiting times. It also identified that staff shortages, as I've already mentioned, in social care in Cornwall were amongst the highest in England, and CQC reported that that resulted in a shortage of domiciliary care packages and care home capacity, and assessed that meant many people could not be safely discharged from hospital, and reported that that had a significant impact on patient flow across urgent and emergency care. Our Trust has put in place a set of urgent actions to help to address those challenges, and our system partners are also progressing actions urgently to seek to address that. One of the most important of those system actions is a programme of work to support the discharge home of patients who can go home with social care and domiciliary support, and we work very closely with our system partners to progress that. During last year, we achieved 94% of stroke patients receiving a CT scan within 4 hours. However, a number of our other stroke measures did deteriorate as a result of the operational pressures I've mentioned. That continues to be an area of significant priority for us, so we can support our stroke teams to improve and return to our previous excellent stroke performance levels. Staff across Royal Cornwall hospitals worked so hard to manage through COVID. They really are truly amazing. Our microbiology laboratory and contract tracing services played critical roles in helping manage COVID outbreaks, reducing risks for colleagues and providing them with expert advice. They also rolled out asymptomatic testing for colleagues in Cornwall Partnerships NHS Foundation Trust. Kim will shortly summarise the great work underway across our organisation to ensure we provide the very best quality, safety and experience to patients and users of our services. But I would particularly like to acknowledge our Trust's amazing work to progress improvements in maternity services through our work to implement the national Audited recommendations. To me, one of the most striking performance summaries that we have is the proportion of people who would recommend our hospitals as measured through our friends and family test. 98% of our inpatients who completed the survey would recommend our hospitals. 97% of users of our maternity services rated their antenatal care as good or very good, and 95% of users said the same about birthing services. I recognise that we don't get it right every single time, and we always start our public board meetings with a patient or a staff story so we can learn lessons and help to deliver improvements. However, those friends and family test results really are a fantastic reflection of the care and compassion of Royal Cornwall Hospital staff, and I would like to say a personal thank you to every one of our staff who do such an amazing job every day. Our second strategic objective is about brilliant people. And clearly we're a major employer in Cornwall and a cornerstone of the services across the Duchy and the Isles of Scilly, with over 6,700 people providing care and supporting care across our 3 hospitals and in other sites across Cornwall and the Isles of Scilly. Our staff come from a really diverse range of backgrounds and locations, with staff from over 60 countries around the world. We have, as many parts of the NHS have experienced recruitment challenges in a number of roles and disciplines, and as part of our plans to address that, we recruited around 125 international nurses to help address the vacancies within our nursing workforce. That international nursing recruitment programme has been really positive and has had a significant impact on helping us to address our nursing workforce vacancies, and that continues alongside our local and national recruitment this year. Recognising the significant and the sustained challenge that our staff have been working in, we've done everything we can to expand the well-being and other support that we offer to staff, including mental health and support forums to help build staff support networks and to do everything we can to create the right environments to support our staff in the face of the exceptional challenges that health services are facing. This week, we're holding our annual Staff Awards event to recognise the outstanding care, compassion, dedication and innovation of our staff. For every one of you who's been nominated for an award, I pass on my thanks for your outstanding work that you do to support our patients and service users. In fact, all of our staff do amazing things every single day, and it's a privilege to have the opportunity to be your Chief Executive and to do what I can to support you in the fantastic and important services that you provide. I'd also like to acknowledge the outstanding work of our volunteers, many of whom are also members of our leagues of friends allied to our hospitals. They've continued to play a really vital role, and for many they've had to radically change how they support our patients, relatives, staff in the COVID pandemic. They supported our mass vaccination centres, prepared going home essentials bags, check-in phone calls when patients got home, and 1,000 other ways to provide support. Their contribution has been truly outstanding, and on behalf of our board and our organisation, we really are truly grateful. Our third strategic objective is brilliant improvement. And throughout the 2021-22 year and the COVID and the operational challenges, our amazing cancer teams were able to maintain many of the national cancer standards, whilst in many other parts of the NHS, cancer performance deteriorated. The number of patients waiting more than 104 weeks or 2 years reduced to less than 40 at the end of the financial year, and that represented a significant improvement. But we are absolutely determined to do all we can do to bring those waiting times down further, with an expectation that no one would wait more than 78 weeks by the end of March 2023. Our elective recovery has been and continues to be impacted by the ongoing operational pressures and our COVID challenges. One of the actions we took early in COVID was to move our trauma ward to St Michael's Hospital to create more capacity at Royal Cornwall Hospital. Our staff involved in that change were amazing, working really quickly to deliver new pathways of care to enable that important and rapid change. Whilst COVID demand has reduced since then, the ongoing operational pressures and the numbers of patients fit for discharge but waiting in hospital beds has prevented that ward from returning to Royal Cornwall Hospital. And that change, coupled with the ongoing operational pressures we face, has impacted our ability to increase further our elective activity. We've seen a whole range of great improvements delivered throughout the year. Our Building Brilliance Estates programme has delivered the opening of the first phase of the Tremenal Units ward that I mentioned earlier, to establish an innovative reablement winter ward and a training centre to develop the skills and capacity of care staff. That directly supported our Trust's winter pressures and also helped to maximise people's ability to mobilise more quickly and return home. Construction on the MRI Cancer Centre has progressed really well, with an expected completion date of March next year. We secured planning permission for a new outpatient centre at the West Cornwall Hospital, and funding was secured to expand day treatment services at St Michael's Hospital. We're also now, as you might know, progressing the plans for the Women's and Children's Hospital, with funding recently announced and secured for the enabling works, and we expect to develop an elective surgery treatment centre at Bodmin Hospital over the coming year in partnership with Cornwall Partnership NHS Foundation Trust. Underlying all of our improvement work is an even bigger commitment to equality, diversity and inclusion. We've invested in new roles, developed our equality, diversity and inclusion strategy, launched our reciprocal mentoring programme, developed our staff networks, and ensured that all of those steps are monitored through our People and Organisational Development Committee on behalf of the Trust Board. As Carl will shortly outline, our Trust delivered a small financial surplus for the last year, and we currently anticipate a break-even financial position for the current year. However, NHS resources locally and nationally are under exceptional pressure, and the challenges we face to deliver financial sustainability continue to be significant. So with that summary, I'll now hand over to our Deputy Chief Executive and Chief Nursing Officer, Kim O'Keefe, and ask him to summarise the key quality, safety, challenges and achievements over the last 12 months. Thank you, Kim.
Thank you, Steve. It's really, really difficult to pick out the great and the good from our quality account in 21-22. So for those, if I miss anything out, it's not that it wasn't important, it's just a time factor, and I encourage everyone to read it if you haven't already. So starting with responding to national recommendations for maternity care, we're really, really proud of the services we provide through our maternity services. I'm very proud that we work closely and in partnership with Kono Maternity Voices to make sure that we empower women and pregnant people in their pregnancy and birth choices. We are fully compliant with the 10 CNST, which is a clinical negligence scheme for trusts, safety standards, and currently we are compliant with Audited 1 recommendations and remain diligent and working through Audited 2. We are not complacent. We absolutely want to sustain and provide services that are safe for our families. We've established over the year a formal birth reflection service, which is an ability for someone who's had a difficult birthing episode to be able to discuss that and receive support, and especially being supported when they come in future pregnancies. Despite all of the COVID restrictions, we maintained one-to-one care in all labours during the COVID pandemic period. And we have continued to improve our support for bereaved patients when they have had a very sad ending to their pregnancy. We have increased and listened and fully supported the numbers of leadership and specialist roles which further support both staff and our families as they use our services. And to that end, we've established a midwifery team that provides individualised mental health support to pregnant people, those with new babies and their families. Equally important, and you heard Steve, our Chief Exec, talk about it, we provide additional support to economically, culturally or emotionally vulnerable pregnant people and their families. And this, we've had increased referrals even during this year, as we know the very, very poor economic backdrop that we are currently working with. And as I've said, we will continue to work hard to make sure, especially with all of the national press and the scrutiny on maternity services, that we continue to learn and offer safe and effective services for our families. Next slide, please, Pete. So looking at a better experience for our patients, as a board we have always said, and we listen, we want to provide individualised experiences for our patients and their families and loved ones. During the pandemic, we realised the absolute restrictions of both loved ones and patients in our care when they were not allowed, or we were not able to offer visiting options. So we created the Stay Connected electronic platform and hand delivered where we needed to, and that's worked really, really well. We've continued to develop our carers passport, and this includes free meals for carers, refreshments, and we launched the free parking in 2022. We have a fully accessible standards compliant website, and we will continue to work on that. Improving health and well-being, as you've heard Steve talk about, is absolutely key critical, and we introduced the blue and the green therapies for the prevention and treatment of stress and anxiety in an extremely difficult backdrop for our staff. And we've also introduced a clinical psychologist who works with our occupational health support team to further be able to support our staff. Next slide, please. Learning from incidents and improving safety is always key to our clinical practice, and we were one of 7 early adopters of the new patient safety and investigation framework, and that is helping us identify immediate learning, but also theming and making sure that we learn from those and avoid future incidents. 132 out of 136 actions for our never event response has now been completed, and we're working hard to complete the final 4. And it's really important to note we had no never events in a year's period, which was a tremendous testament to our staff listening, for us listening and learning and making sure they got the education and the support they required. And to that end, we've trained over 1,800 staff working in invasive surgical procedures, have been trained in human factors, patient safety, and the importance of the WHO safety checklist. We have seen a 13% reduction in serious harm from falls, but we have seen a 25% increase in harm from pressure ulcers, and this is testament to patients coming in who are elderly, have been isolated potentially. We are seeing malnutrition from both the economic restrictions, both for food and fuel, and the teams are working hard to make sure that we're providing the care and the aftercare they require as they move through our health and social care system. Next slide, please. So, new services that support safer care. We're always looking to provide evidence-based and the modern care that our patients require. And following on from the update of Steve from Wilvore Ward, we established a reablement worker role to work both across health and care in any part of the system to support our patients to regain and maintain their independence. And so far, we've trained over 100 of our staff who've gone on to work in many of parts of the system, including our 3 hospitals. And all 100 were not just trained, they had their competencies signed off and are happy working in their chosen place of work. Our volunteers, as Steve said, not only supported our vaccination centres, but they support our patients in going home, providing discharge bags and making sure they have pastoral telephone calls as they settle back into home. Next slide, please. Reducing delays that can lead to harm. As you've heard Steve speak about, we are absolutely working hard to make sure that in such operationally challenged environment, we're trying to reduce the delays that can lead to harm. So we're expanding our same-day emergency care services. We're encouraging more people to think 111 first, as opposed to using our emergency department. We're improving our care at the front door for the pathways for our frail elderly patients in our emergency department, which means that we have frailty nurse specialists at our front door to try and make sure that where we can to avoid admission with the correct support, or to make sure that they are guided through our wards and back out to their chosen place of discharge. Importantly, we're updating and improving our nursing care documentation, and because I have a dual role, it's no surprise that we're doing it across both RCHT and CFT. Many of our patients move across both of our organisations, and we want to make our nursing documentation easy to use, not repetitive, and making sure that it's meaningful to cut out delays to medication, for example, when patients are due to go home. We continue to work hard at improving our discharge planning, and we have our operational flow programme where discharge planning is one part of that. We have now relocated our discharge lounge and want to ensure that no one is waiting more than 78 weeks for a routine care by the 31st of March 2023. So as I've said, much to celebrate and still a lot more to do, and you'll hear more about that as we move through our programme. So thank you, and I think I'm handing over to Carl, who's our Chief Financial Officer.
Thank you, Kim. Good afternoon, everyone. As Kim has said, I'm Carl Simpkins, the Trust Chief Finance Officer, and I'm very pleased to present a summary of the Trust's audited financial statements for 21-22 to this annual public meeting. Thank you, Pete. First slide. Thank you. With the challenges the NHS faced with COVID, the financial regime arrangements and funding mechanism for 2021 changed significantly from that in previous years. This regime continued for the last financial year in 21-22 and included a number of key factors. A continued move away from the more traditional contracting arrangements to block contracts with commissioners, health systems operating within a 2 6-month financial period rather than one 12-month period, the impact of which is significant planning revisions and financial planning and modelling linked to the refreshed national guidance in response, of course, to the ongoing pandemic. The Trust received a series of top-up funding and COVID support funding, different levels last year compared to the previous year, but still important to deliver much of the testing and vaccination programme that Steve has set out in terms of the huge delivery and logistics that were required to successfully roll out that programme, as well as additional capital resource for critical equipment and investment. And I'll touch on that on a later slide. Next slide, Pete, please. With regard to key financial performance measures in 21-22, I'm pleased to report that the Trust delivered its key financial targets, including an outturn of a small, less than 0.25%, £900,000 surplus outturn against a planned break-even plan. That was also within the system context of the system achieving its financial targets within the CCG and CFT. We also met our statutory financial duties in respect of cash and capital. And as you'll see on the slide there, I would also like to point out a couple of other key facts in relation to 21-22. Firstly, this was the second year of significant levels of capital investment for the Trust, with £44 million of additional capital resource and expenditure last year. For those that were joined the APM last year, it was around 56 million, so £100 million of capital investment across the 2 financial years. In my 10 years with the Trust, that's a significant level of capital resource, and hopefully we can see that continue into the future. We also saw further growth in our income last year, with the Trust turnover at 581 million in 21-22. An 8% increase from the £537 million received in 2021. We're also able to maintain our better payment performance targets, with over 94% of all non-NHS invoices by volume, that's around 100,000 plus actually invoices, and value paid on time by the Trust. I think that's a significant performance measure that probably goes under the radar sometimes in terms of our key financial metrics. Next slide, Pete, please. Against our £581 million income, this slide highlights where that income and which supported the turnover, of course, comes from. The most significant elements of income from CCGs, and in the main for us, Kerno CCG at £409 million. Further top-up funding to support the main COVID additional components, as we've set out, £13 million, and £106 million received directly from NHS England, including, for example, specialist commissioning income for specialist cancer drugs. The final component of our income is around £52 million, including a key component for education, training and research income of around £19 million. I'll just leave that slide up just for a second or two while people can digest it. Okay, thank you, Pete. On this slide, I'd just like to highlight the breakdown of our expenditure by type, which is broadly consistent actually with previous years, although value-wise significantly increased because, of course, the expenditure in the main matches our growth in income. I would like to touch on the £341 million spent on staffing costs, which is around 59% of our total expenditure. This compares to 309 million in the previous financial year, quite an increase actually in our key area of expenditure and perhaps our most important in terms of supporting care across the hospital, our 3 hospitals. The other one just to touch on there is around supplies and consumables, around 134 million. That compares to 130 million pounds in the previous year. Once again, I'll just leave that slide up just for a few seconds for people to digest. Okay, thanks, Pete. This slide represents around 75% of our overall expenditure, which is targeted within our care group structure. And you'll see there the way we manage our organisations across the care groups, and of course then how we've distributed and spent that broadly £580 million across key areas of service. Once again, if I may, I'll just leave that up for a few seconds for people to reflect on overall expenditure in each of our areas. Okay, thanks, Pete. This next slide touches on areas that both our Chief Exec and Deputy Chief Exec have covered, and it reflects on our capital projects and investment. And as I said, this was £44 million in the last financial year, adding to the £55 million spent before. The major schemes and the expenditure linked to that are the development of the 2-storey modular building, providing additional ward capacity, which we've denoted Tremenal, £12.8 million, including the opening of the first floor, which we've called Wheel Vor, which was used for as a 28-bedded ward. That was £5 million in its own right, and it was a key to providing additional winter capacity through quite a challenging time between January and June. At the moment, we're going through the final fit outs of both floors for that development and expecting its full opening in late October, early November. And that will be a fantastic facility and infrastructure onto the Trellis site to support capacity going forward, and in the longer term to support the rollout of ongoing fire remediation work in Tower Block to enable it as a decamp facility so that we can progress further investment in our capital infrastructure excuse me, going forward into 22-23 and beyond. In addition, we spent a further £9 million on our MRI oncology development, and as Steve has said, the expectation that in between March and May 23, different phases of that facility will open, including both a fantastic new oncology ward and of course the much awaited expansion of our MRI capacity, which will allow us to phase out some of the old MRI equipment in the Tower Block. We spent over £6 million on medical equipment, just under £6 million on our estates backlog maintenance programmes, including progress on our fire remediation works, and over £4 million on digital investments, which includes system upgrades and replacement of much needed IT equipment across the sites. I would like to put on record my thanks to all the teams across estates, strategic estates, operational estates, IT equipping and capital teams, as well as support from our key contractors who have enabled us to make such significant progress on our capital investment in the last financial year and support the ongoing build programmes as we've entered the current financial year, which will again be both a challenging programme to deliver, but hopefully people will see quite significant changes in infrastructure as we come out of the back end of this current financial year that we're in. Next slide, please, Pete. My next slide highlights our external auditor's opinion on the Trust accounts and annual report, which is once again very positive. The opinion reports the accounts give a true and fair view and are properly prepared. There were no unadjusted misstatements. The one area I would like to highlight to the board and the APM is that there was a limitation of scope technical qualification linked to prior year audit of inventory balances due to the COVID arrangements, actually, although this was noted at a national level as a consequence of the COVID pandemic, and which affects many trusts which have material stock levels. As I say, it is a technical qualification and one that does not affect the substance and accuracy of our accounts. We've also had issued a Section 30 referral to the Secretary of State regarding our ongoing cumulative deficit, which was made in prior years with the expectation that the deficit would not be recovered in 22-23. That was an expected Section 30 referral, and once again it is a reflection of historic arrangements rather than arrangements reflecting purely the 21-22 financial year. We've also received for the second year which was a new report last year, the Auditor's Value for Money report, which also in summary identified no significant weaknesses for securing economy, efficiency and effectiveness in the Trust's use of resources. I would also like to put on record my thanks to the finance team and everyone associated with help and support with the financial production of the financial accounts, the annual report this year, and people within the organisation, staff within the organisation that have helped deliver, of course, quite a positive set of financial results for 21-22. And thank you, just Pete, just the final slide, linked to the annual accounts and report. And I'm sure Sean will give a further update on where the accounts can be accessed, but just for the final slide, if people can see, clearly all this information is available publicly, including the Value for Money report. If anybody needs access to it, obviously we can message through Sean and as the company secretary, and we're very, very happy to provide the annual report and the annual accounts to people that require them. Thank you. And now I believe I'm handing back to Steve for his closing remarks.
Thank you, Carl, and thank you, Kim, for the updates that you've just provided. I think I have to say that the work of staff across Royal Cornwall hospitals over the last 12 months to support those outcomes, those achievements, and to manage in that exceptionally challenged COVID and operational environment that we've covered is really amazing. And I would like to thank again every one of our staff for the outstanding work in an outstandingly challenged environment that every one of you do every single day in supporting our patients, our service users and each other. Thank you. We'll now close our online questions. Thank you for all the questions that we've had so far. We will answer them, but before we do, we're going to play a short video which celebrates the work of our amazing staff over the last 12 months.
We started with hope. The COVID-19 vaccination rollout had begun, and we'd set up mass vaccination centres in Truro, Stithians and Weybridge. Since the first vaccinations in December 2020 and continuing throughout the past year, more than 858,000 vaccinations have been given to over 370,000 people in a variety of settings, from their own home to care homes to the mass vaccination centres. Over 6,700 volunteers and staff from RCHT and NHS partners across the county gave their time and expertise to protect the people we serve. It was truly inspirational and represented a coming together with energy and resolve to start to turn the tide of COVID-19. We are so proud of our research teams for their contribution to the pioneering efforts of scientific teams across the country to find and test new vaccines and treatments to tackle the pandemic, and which have been influential in the fight against the virus. The impact on our staff has been significant, as we've tried to manage the best we can amid unprecedented pressures and a sustained period at critical incident operational level, whilst caring for people who need our help and remaining absolutely clear in our priority to keep patients and staff safe. We put in place a variety of ways to support our people, from a 7-day-a-week helpline to cold water swimming therapy, and our RCHT charity and friends at the hospitals have played their part too. We know that supporting our workforce and providing colleagues opportunities to recharge, develop, and try new things is a fundamental of our focus for the year ahead. Our annual Brilliant Youth Virtual Festival and Thank You Week saw 40 teams and individuals presented with awards, and more than 390 received nomination certificates. Our people have also been recognised at regional and national level with Health Service Journal, NHS Digital Cyber Associates Network, Paediatric Awards for Training Achievement, and Cornwall Apprenticeships, among the long list of awards celebrated over the last year. Yet, amid these unyielding pressures, we have continued in our ambition to provide brilliant facilities in which to provide brilliant care. This was exemplified by the completion of Wheel 4 ward in the Tremeno unit, completed on budget and to a testing schedule to help us respond to the additional demands of winter. Not only offering excellent facilities, the ward team delivered an innovative model of care, combining re-ablement for frail and elderly patients, as well as a training base for new recruits into care. Originally a short-term project, its success has seen the Wheelvore team move to St Austell Community Hospital, where the model of care is being developed for further expansion to other community hospital sites. The Tremeno unit is now being refitted for its next role, where it will house our inpatient oncology ward, Lowen, until the new MRI and oncology unit opens in 2023. This is one of the key moves as we prepare to release the space for the eagerly awaited Women's and Children's Hospital. Alongside physical developments has been the introduction of new digital technology in every aspect of our lives within RCHT, with the pandemic leading us to bring forward advances more quickly than we might otherwise have done. For our patients, the most visible of these has been telephone and video appointments, alongside automated text appointment reminders and virtual waiting rooms, and most recently, the Patient Hub online platform, where people can see and manage their own appointments. Whilst maintaining letters and face-to-face options for people without access to digital platforms, these changes have been welcomed by patients of all ages, reducing the need to travel, as well as resulting in far fewer people not attending their appointment. As we look to the future, these digital advances are also a key part of our commitment to reducing our carbon footprint as a joint signatory to the Cornwall Public Service Climate Emergency Declaration. We have been leading the way in the use of reusable PPE, including face coverings for non-clinical areas, and, more recently, the trial of reusable face masks for clinical areas. Taking this a step further, we are now piloting the use of fully reusable PPE, including theatre gowns, in our theatres. We've also been looking at how we can introduce changes to treatments, medications, and the way we deliver care to reduce their impact on our environment, such as educating people on the effective use of inhalers and moving to powder-based options wherever appropriate. As we know, our biggest challenge is making sure our communities can access the right care in the right place when they need it. None of us want to see patients waiting for ambulances, waiting to be admitted to hospital, waiting for planned operations, nor waiting to leave hospital when they're ready to go home. our need to work with partners across health, care, and the voluntary sector has never been greater, as only together can we tackle the difficulties we face, not least those posed by a highly competitive recruitment market compounded by shortages of affordable housing. We will need to take innovative approaches to our future workforce, offering flexible employment and rewarding career pathways, making it possible for people to stay in our county, to develop the talent we have, and to attract others to come here too. Our ambition to become a teaching hospitals trust will play an important part in building our national and international reputation as a place to learn and grow. Wherever possible, we want people to be able to access their acute care in Cornwall, rather than having to travel to Devon or elsewhere. We also want to ensure that where appropriate, people can receive care closer to their home, rather than on the acute site. We know that to sustain improvements in health and care, we need to work collaboratively with our health and care partners. We want to strengthen clinical partnerships, both locally with integrated care areas, primary care networks, and the Cornwall and Isles of Scilly integrated care system, as well as regionally with acute providers in Devon and Bristol. We must also continue to seize the advantages digital advances will bring to improve patient care and safety, as well as the efficiency and effectiveness of our services. What might have been regarded as science fiction a few decades ago is fast becoming part of everyday life, with our clinical specialists increasingly using artificial intelligence and virtual reality technologies in diagnosis and treatment. It presents new opportunities for our patients to have greater control of their care records through the advent of shared online systems between health and care providers, electronic health records, and appointment systems. We by no means underestimate how much we have to do as we recover from the pandemic and tackle the very real challenges that remain for our health and care system in Cornwall, and not least to ensure our patients receive the safe and timely care they rightly deserve. To our people across Royal Cornwall Hospital, St Michael's Hospital, and West Cornwall Hospital, we say thank you for your care of our patients and for your care of each other. We are here to care for you.
Thank you, Steve, and my heartfelt thanks to Pete Young, Laura Mason, Rich Pearson in our very talented communications team who designed the engaging infographics in the slide deck, and for scripting and putting together that wonderful video. I know it will have represented many hours of very careful work and editing, and it's a real something for us all to be proud of, but we're proud of you and your team, Pete. Thank you. I would now like to invite our board formally to receive and adopt the Trust's annual report and accounts for 2021-22. If you'd be kind enough to indicate in the chat your approval. While you're doing that, may I take the opportunity to thank you, Steve, and our executive team for the leadership you and your teams give in our trust. And what we've seen this afternoon and we see in the report is a real credit to you and all the teams. Thank you. So we're now going to move to item 6, questions from members of the public. We have up to 15 minutes to take questions in line with the protocol set out on the agenda. Please could I ask Sian Millard, our Company Secretary, to put the questions to the board. Thank you, Sian.
Thank you, Chair. We've had one question from Mario Dunn of Health Watch, which I'm going to put to Steve. Thank you, Mario, for your question. Mario asks, can you update the meeting on plans to improve hospital discharge processes in order to reduce ambulance to emergency department handover times? Thank you, Steve.
Thank you, Sian. Thank you, Mario, for that question. It's absolutely the case that we've been working under significant and sustained operational pressure since October last year, and that has had a direct, significant and sustained impact on ambulance response times. And we absolutely recognise the impact on our ambulance service colleagues of the challenges in our health and care system, and of course recognise the significant impact that has on patients and communities across Cornwall who rightly rely on those services. It is in fact our overarching priority at Royal Cornwall Hospitals NHS Trust to take actions to address the delays in our ambulance handover and response times, and I know it's a significant priority for all of the parts of our health and care system. We do work very closely with South Western Ambulance Service to minimise the impact on ambulance performance, and when we do have ambulance waits, to manage this in the most clinically appropriate way. It's absolutely clear that Royal Cornwall Hospitals has a critically important role to play in minimising ambulance delays. However, this is also a system-wide issue, and our ability to have emergency hospital beds available, which is directly necessary to release space in emergency departments, which of course is directly necessary to allow ambulances to transfer their patients in return. That is dependent on the ability to discharge patients who finish their hospital stay to home or to their residential or other care setting when they finish their hospital treatment. We have at Royal Cornwall Hospitals developed a comprehensive patient flow programme earlier in 2022 to directly help and address those factors that are within our control. For example, opening additional bed or ambulatory space capacity where it's safe to do, and taking further actions to enable patients to be discharged earlier in the day to release those essential inpatient beds. We've also progressed innovative care models within Royal Cornwall Hospitals and in partnership with other health and system partners to help reduce avoidable admissions and to help improve discharge processes. That's included new pathways of care, for example, the management of low-risk chest pain pathways, the development and progression of virtual wards, improvements to hospital flow processes, a new location and facility for our discharge lounge, and a range of other actions, all directly designed to improve and support the ability to discharge patients. Alongside that, we've also increased capacity within our emergency department and in our ward areas and elsewhere. And in October this year, we'll be opening a further ward, which will be focused on additional elderly and frail care support. We've seen benefits from all of that work, but the situation remains exceptionally challenging. And in fact, with all of our actions, we have not seen a significant or a sustained reduction in the number of hospital beds occupied by patients who finished their hospital treatment and are waiting for discharge. I mentioned earlier on that the Care Quality Commission, in a system-wide inspection earlier this year, reported that vacancies in social care in Cornwall were amongst the highest in England, and assessed that that had a direct impact on domiciliary care capacity and residential capacity, and those things had a direct impact on emergency department and ambulance delays. That's really primarily because at any one time we'll have around 4 hospital wards of patients who are medically fit for discharge but are waiting for support to go home or into a residential care setting. That's just within Royal Cornwall Hospital beds. If we look at all hospital beds in Cornwall, those provided by Royal Cornwall Hospitals and Cornwall Partnership Hospitals NHS Foundation Trust, we will regularly have about 200 hospital beds occupied by patients fit and waiting for discharge, and therefore not available for new emergency patients. Our system partners are working really hard to address that, and we work very closely with all health and care system partners to rapidly progress potential solutions to those challenges, and we continue to do so. One of the current system intentions is to progress the ability to discharge to home those patients who will ultimately go home but need to have a care needs assessment to be undertaken and then need care arrangements to be put in place. It's our intention that rather than patients wait in hospital for those things to happen once they're fit for discharge, that with system partners we enable those patients to go home so that assessment can be undertaken in their home environment and those care packages can be put in place in their home environment. That hasn't yet been able to be realised at scale in Cornwall and the Isles of Scilly, but it's one of our key system priorities to enable us to progress. That's important for us because if I give an example, on Tuesday this week, 75 hospital beds in Royal Cornwall Hospitals NHS Trust or in Cornwall Partnerships NHS Foundation Trust were occupied by exactly those patients who no longer need to be in a hospital, who will go home, but require a needs assessment and a care package to be put in place. So if that service can be rapidly implemented with all partners working together, that would have an immediate and a significant impact on improving ambulance response times. So Mario, to conclude, we are doing everything we possibly can as Royal Cornwall Hospitals NHS Trust to improve discharge processes, and also working really closely with all other health and care partners in our system to play our part in working with system partners to ensure the system does everything it can to address those challenges. Thank you.
Thank you very much, Steve. Sian, further questions?
Thank you, Chair. No further questions.
Thank you very much. Thank you indeed to members of the public for those questions. So that brings us now to the end of our annual public meeting. I hope that it has been informative and provided you with a good account of what we have been doing in this last period. I would again like to thank all members of the public, all of our staff, all our patients, their families and stakeholders for their engagement and interests. As Steve has just been saying, we are absolutely dependent on each other to provide a really great service. I would also like to thank members of the board for your continuing stewardship of the Trust. Thank you. I now wish you all a very peaceful evening. Thank you very much for your attendance. Goodbye.